So, what's the most vital sign of a truly healthy hospital? Well, of course, it's the quality of care, but it's also something else. It's that constant flow of new patients. And if that flow is slowing down to a trickle, the problem might not be in your operating rooms. It's probably in your marketing. Does this question hit a little too close to home? You know, you've got world-class doctors, state-of-the-art facilities, but the waiting room is just looking emptier than it should. It's a really common symptom, but what's the actual underlying disease? Okay, here is a number that changes, well, everything. 75%. That's how many patients now go online to do their own research on healthcare options before they even think about picking up the phone. This isn't just a trend anymore, it's the new reality of how patients make decisions. So if your appointments are down, the diagnosis is pretty clear. The problem isn't the quality of your medicine. It's that in this digital age, patients either can't find you, or maybe even worse, they're finding your competitors first. It's a marketing problem, and it has a digital cause. All right, so we've got our diagnosis. It's a marketing gap. But what's the underlying condition that's causing it? Let's dig a little deeper here and look at the specific signs that your digital strategy might be, well, a little unhealthy. Just take a quick look. Does any of this ring a bell? You're seeing tons of traffic to your website, but nobody's actually booking an appointment. Or how about this? You notice your competitors are always at the top of local search results. These aren't just minor things. They are huge, flashing red flags that your digital health is at risk. And look at this contrast. Yesterday, marketing was all about shouting your message from billboards. Today, it's about being the trusted answer that pops up the moment a patient quietly searches for care or starts reading online reviews. It's a total shift from a monologue to a real dialogue. And that brings us to a really crucial point. Your website, your social media, your online reviews, this whole thing is your new digital footprint. It's the very first thing potential patients see. And believe me, it's what they use to decide if they can trust you with their health. But here's the good news. An unhealthy digital strategy? It's totally treatable. We've got a clear, actionable prescription for growth. It's a 5-point plan, and it's designed to get your hospital's patient numbers back to peak health. And here it is, the prescription itself. It all starts with a healthy website. Think of it as your digital front door. Next, we use high-visibility SEO so patients can actually find that door. Then we fill it with trust-building content to welcome them inside. We use social media to become a real part of the community's conversation. And finally, targeted ad campaigns help us reach the exact patients who need specific services right now. Now that second point, SEO, I know it can sound super technical, but it's arguably the most critical part of this entire treatment plan. So what is it really, and why is it so incredibly vital for hospitals and clinics? Let's just forget all the tech jargon for a minute. In the simplest terms, SEO is about one thing. When a worried parent searches for pediatric clinic near me at 2 in the morning, your hospital is the very first name they see. It's about being the answer when your community is asking for help. And this brings us right back to step 1 of our prescription. When a patient finds you through that search, your website becomes their first impression. If it's slow, if it looks broken on their phone, or if it's just plain confusing, they won't think twice about leaving and knocking on your competitor's door instead. But you know, a great website is so much more than just a digital brochure. It needs great content. We're talking about information that genuinely helps people, blog posts that answer common health questions, inspiring patient stories, profiles that show off your expert doctors. Every single piece of content is another brick in that wall of trust you're building with your community. So let's say you followed the prescription. You've totally revitalized your digital presence. What happens next? What's the prognosis? Well, I am very happy to report that the prognosis is overwhelmingly positive. And the results, they aren't just a vague feeling, they're concrete things you can actually measure. As you can see here, we're talking about a direct increase in the metrics that truly matter. More appointment bookings, a better online reputation, and a much wider community reach. Let's just trace the impact for a second. A smart digital investment drives more people to your website. And because that site is trustworthy and easy to use, more of those people book appointments. Your reputation improves, and all of a sudden, your vital community health programs are reaching a way bigger audience. You see, each step directly fuels the next one. Okay, so now it's time for a little checkup. We've walked through the symptoms, the diagnosis, and the prescription. It's time to turn that lens on your own organization and really assess your hospital's digital health. If there's one single idea to take away from all of this, let it be this one. Your online reputation is now every bit as important as your medical reputation.
In this day and age, you just can't separate the two anymore. They're completely linked.
And that leaves us with one last really crucial question for you. Based on everything we've covered, what is your hospital's digital health score? Is it thriving, or is it maybe in critical condition? The very first step to a healthier future is an honest assessment.